On a Sunday morning in late May, I unfolded the New York Times to see its entire front cover taken over with obituaries. A tapestry of death, woven in tiny font. A name, an age, where they lived, a snippet of their life. Anne Sullivan, 91, Woodland Hills, California, animator for Disney films, including The Little Mermaid. Landon Spradlin, 66, Concord, North Carolina, preacher and blues guitarist. Kias Kelly, 48, New York City, nurse in the COVID fight. 1,000 people, 1,000 miniature obituaries. I squinched my nose to keep my tears from overflowing. They represented only 1% of the estimated 100,000 people in the United States who have died from this new coronavirus, almost all within a 3-month span. The fragments of their lives had the odd effect of making their deaths more significant. My gaze fluttered across the page and landed on details. Deep-hearted country girl, read one. Worked as a meat cutter, read another. One of my favorite New York Times reporters, Dan Barry, wrote the simple prose on an inside page. A number is an imperfect measure when applied to the human condition. A number provides an answer to how many, but it can never convey the individual arcs of life, the 100,000 ways of greeting the morning and saying good night. That was May 24th. By the time you listen to this podcast, that number will probably be closer to 150,000, probably more. The real death count is doubtless far higher than the official death count. Predictive models differ, as statisticians, epidemiologists, and public health experts around the world try to factor what a spike in infections might look like in mid or late summer, as states open up and new hotspots emerge. Nationwide and statewide protests are confounding those equations. It's not just numbers of people gathered together for hours either. Tear gas and pepper spray, chanting and singing, all may raise the risk for transmission of this sometimes deadly virus. Predicting future death or illness in a pandemic is both science and art. Human behavior is a bear to predict. Even my own behavior can be a stranger to me. Yet, in these weird times, my knowledge, my fear, my action, even my moments of joy and humor often arise from sources I've depended on for decades. Good journalism, especially good science journalism. Because despite nearly constant layoffs in newsrooms worldwide, despite the bad press that labels the press bad, it's the responsible and responsive news media who've helped us start to understand and protect ourselves against this highly contagious and still mysterious virus. Good science and health reporters give us access to information that would take us years of expertise to understand. They enter worlds and explain concepts that can be unfamiliar to us. The refugee camp, the deadly combination of overworked and poorly paid nursing home workers and their vulnerable patients. How an ordinary choir practice in Washington became a super spreader event. Why developing an effective vaccine is so difficult. I'm not exactly sure what day I realized COVID-19 was going to change our lives here in North Carolina for the foreseeable future. It was probably late February. That's when I read about the first cases appearing in California and Washington, with no connection to international travel. By early March, for the first time in my life, I had hand sanitizer prominently displayed on my office desk. I was wiping the desk down and dashing down the hallway to wash my hands between appointments. I even started using my elbows to do things my hands, with their lovely opposable thumbs, were designed for. I am intensely aware of the day my husband and I ate our last meal in our favorite pizza place, how clearly we both knew it was our last meal out. I scoped out the restaurant as we entered, like an old gunslinger in a bad western who knew staying alive meant finding a spot where I could see my enemy coming through the swinging doors. Yeah, I knew the virus was invisible, that it didn't really have a personality. I still didn't want it to find me. We slunk into the furthest corner of the bar on a quiet Saturday afternoon. How did David and I both know it was our last time in an indoor public place for a while? Because both of us pay a great deal of attention to journalism, and especially to good science journalism. Perhaps this sounds like an excess of caution. By that day, March 7th, only 2 cases of COVID had been identified in North Carolina. Across the United States, only 19 people had reportedly died, all on the West Coast. But we'd been reading a lot of sources: the New York Times, the Washington Post, the Guardian, the Atlantic, and Science and Nature, the 2 premier journals that carry both news and peer-reviewed research. We knew people around the world were dying. More than 3,000 in China, 145 in Iran, and 230 in Italy, many near Milan, where we have friends we know and love. Many of us, probably you included, tend to read or watch or listen to media when we already have knowledge about something. It's human nature to be drawn to subjects we love or that we're already interested in. For me, that's dogs, food and farming, climate change. But sometimes we need to learn beyond our own specific interests and particular obsessions. COVID makes that clear. As I record this, the United States has just surpassed 2 million diagnosed cases. It's going to be with us for some time. One science editor, Liz Neely, described our situation like this: "We are all science communicators now. COVID-19 has conscripted us." While I'd rather not be enlisted in this particular virus crisis, it's clear to me that good science journalism is a lifeline in the age of COVID, because it can change our behavior and help keep us safer, and our friends and loved ones safer. We all exchange information and tips and the latest stories and studies. Not everyone shares my perspective. I remember how resentful I was during that final meal out when 2 women decided to plant themselves just 2 bar stools away from us, laughing and talking. I mean, come on, COVID. Aren't you listening? Aren't you reading the news? The restaurant was almost empty. Shoo, I thought, distance yourselves. Then I turned to my salad. The food and wine were fantastic, as always, but we were in mourning, already missing something that to us was both ordinary and beloved: eating out. It was mid-afternoon, Saturday, March 7, in Carrboro, North Carolina. How do I know the time and date exactly? Because I'm a journalist. So I trust my memory only to a point. I double-checked the time with my husband and looked on our joint calendar. I pulled up our credit card statement. I considered whether I should call the chef owner to see if he had a menu from that day, but decided not to bother him. I know he's busy recalibrating his business to protect his staff and customers and provide safe orders to go. Why might I check all those things before writing or talking about it? Because facts matter. Because good reporting depends on getting the facts right. And because even though I'm writing a small snippet of a moment from our lives, that matters. That's why all the tiny obituaries in the New York Times matter. It matters that they spelled the names of the dead correctly and got that person's age right and what they loved. Season tickets for the Seahawks, collecting stamps, backyard birds so tame they would land on her hand. But over and above the important ritual of acknowledging the existence and life of a human in an era where we cannot hold funerals without risk and sometimes can't even be with our loved ones when they die, why care about good journalism? And why is science journalism so critical in this moment? One of my favorite science journalists, Ed Young of The Atlantic, who's a big picture kind of writer, notes that COVID is now too complex, too befuddling for any one person to understand. It's a slew of forces, scientific and societal, epidemiological, and epistemological. It reminds me of a popular meme among fans of the old television show, Mr. Rogers' Neighborhood. Mr. Rogers' advice to children: look for the helpers.
When I was a boy and I would hear about something scary, somebody getting badly hurt or something like that, I'd ask my parents or my grandparents about it, and they would usually tell me how they felt about it. In fact, my mother would try to find out who was helping the person who got hurt. Always look for the people who are helping, she'd tell us. You'll always find somebody who's trying to help.
It's reasonable advice. For me and some of my friends in this time of COVID upheaval, the helpers I turn to are science journalists. They help explain confusing science and medicine and newly discovered modes of infection. Like Ed Yong does, they help me understand what is huge and befuddling. Here are only a few of the explainers who are helping me in this time. Siddhartha Mukherjee wrote The Emperor of All Maladies, a biography of cancer. He won the nonfiction Pulitzer for that amazing book in 2011. Now he's writing for the New Yorker magazine about COVID. He helps me understand viral spread and how that can happen not only across the population, but right inside a person's body. He writes about what we know and what we don't yet know. As the virus continues to cyclone across the world, he writes, we will begin to find quantitative answers to these questions of how exposure intensity and subsequent viral loads relate to the clinical course of COVID-19. We will supplement the bird's eye view with the worm's eye view. How will these insights change the way we manage patients, hospitals, and populations? I read Amy Maxman's stories, what one science editor calls good shoe leather investigative work. Because good science journalism means looking at the practice of science with a critical eye. Amy Maxman is a senior reporter for Nature magazine and has covered malaria, Ebola, and HIV. Now she's writing about COVID. Will antibody tests really show who is protected from contracting COVID? How do conspiracy theories and misinformation about COVID-19 spread and travel? Then there's Upurva Mandavili, who now writes for the New York Times and was part of a team that examined the missteps of the Centers for Disease Control when that revered federal agency might have helped slow the spread of COVID in the U.S. Quote, and communicating to the public, its leadership was barely visible, its stream of guidance was often slow, and its messages were sometimes confusing, sowing mistrust. Science journalists can also help translate an enormous amount of information into visuals and graphics we can easily grasp. Carl Zimmer, one of my favorite writers and complex science explainers, paired up with a science graphics editor at the New York Times to create an easy-to-understand vaccine tracker that is currently watching 135 vaccines and where they are in the pipeline towards testing and possible approval. So why does explanatory and investigative science journalism matter so much in this time of COVID? Why does good reporting and writing matter? Partly, it's because stories matter. It's pretty primitive, and despite the horrors of COVID, pretty wonderful. This work matters not just because it can help us change our behavior, but because we humans are storytelling and story listening animals. And stories, even grim ones, help us make a bit of order from the chaos of our lives since COVID. But because every life is different, every human being is different, having credible journalists who can tell the stories of others helps me understand the virus and its effect on the world a little better. And I want to know about lives other than my own, even when they end sadly. For instance, Ankita Rao of the UK newspaper The Guardian told the tragic story of Dr. James Charlie Mahoney. Charlie Mahoney was a beloved African-American pulmonologist at a public hospital in Brooklyn hit hard by COVID. Quote, he was handling patients and codes every 5 to 10 minutes, one of his colleagues said. He worked non-stop before he succumbed to the disease himself in late April. He died, a colleague said, running into the fire. So instead of stepping back, good science journalists are stepping up, helping us think about the past, the present, and the future. They take us back to the Spanish flu of 1918 that killed an estimated 500 to 850,000 people in the United States. They tease out how that tragedy might help us cope with COVID now. Or they focus on more arcane but crucial topics, tracing the provenance of a novel coronavirus that bats carry. As Science magazine correspondent Kai Kupferschmidt noted on Twitter, I expected a virus to go global, probably respiratory, probably from bats. How did he know? Because one of the top bat virus experts in the world told him in 2013, 6 years before the first diagnosed case of this now worldwide pandemic. 5 months ago, we didn't have a confirmed case of COVID in the United States. As I record this, nearly 1,000 people are dying every day in the U.S. from this virus. How do we bring those numbers down? An important part of the answer is both simple and complex. Provide good information that people can absorb and act on. I find Story Collider director Liz Neely's words helpful and concrete. It has never been so important to get people to pay attention to hard truths, and perhaps it has never been as difficult to do that as it is right now. The key is to confront the most brutal facts of reality unflinchingly, while maintaining an unwavering hope for the future.